Hello and welcome to this webinar on data-driven enforcement, risks of open payments and Medicare Part D. Especially now that we know even President Trump is behind at least some of the provisions of Obamacare, we know that data transparency movement is here to stay in the US. My name is Mohammed Awais. I'm the CEO and founder at qordata. At qordata, our goal is to make data-driven compliance simple and effective for pharma and device companies. I'm very, very pleased to host Brian Dahl today with me in this webinar. Brian is a principal at Dahl Compliance Consulting. His practice focuses on assisting life sciences companies with their corporate compliance needs. He is the architect of the compliance programs at two top-tier pharma companies, Teva Pharmaceuticals and Takeda Pharma. As a consultant, he has built the compliance programs at 3 startup pharma companies, each of which launched its first product during the term of his engagement. Brian also published 2 chapters addressing the development of a compliance program in the FDLI book entitled Bringing Your Pharmaceutical Drug to Market. Prior to becoming a compliance professional, Brian practiced law both in private practice and at the Federal Trade Commission. Brian received his JD from the University of Iowa College of Law and his Master's of Health Administration degree from UI College of Public Health. I'm very excited and pleased to welcome Brian. So the agenda for this webinar is going to be on the implications of transparency of spend data. And in particular, we will review the case of Insys Therapeutics. Some of you may be aware of the charges filed against Insys Therapeutics, and Brian is going to walk us through several of the state and federal cases against Insys. We'll also look at how data analytics can be used to identify potential compliance risks. And we'll do this in tandem. So as Brian is talking about some of the physicians, I'll take the opportunity to go through the data sets of those physicians. And we'll do this in a tandem way. So Brian, with that, over to you.
Thank you, Mohammed, and thank everyone out there for joining us today. So, what really are the implications of transparency? Mohammed alluded in the agenda that was one of the core things we're going to be talking about today, and we have the statutory penalties under the Sunshine Act for failing to report, and you can see those on screen now. There are penalties both for negligent failure to report as well as a knowing failure to report. And it's important to understand those penalties for not reporting, but from my perspective, it's even more important to understand the potential penalties for what is reported. There's a tremendous amount of data being reported, and we've seen that over the first 3 reporting periods. And all this data presents a huge opportunity for data mining to go on to support allegations of kickbacks against reporting companies when they're making payments in various contexts, including speaker programs, as well as other types of advisory or consulting capacities. And these kickbacks, or if some of these payments are characterized as kickbacks, they can also lead to violations of the False Claims Act for companies who are causing claims to be submitted for their products that may be tainted by kickbacks. So that's what we want to really focus on for at least the first part of the presentation today. And next slide, please, Mohammed. Mohammed also alluded to the fact that we're going to address this in the context of a case study involving Insys Therapeutics. And before I start getting into the details around this, I want to throw out a disclaimer that all of the information that I'm going to present on, and that Mohammed's going to talk about as well, all that information on Insys is public information. Insys isn't a client of mine, and I don't have any information about the company that is not public. So with that said, a little bit of background on Insys. They launched their first drug called Subsys in March of 2012, so just a few years back. Subsys is a sublingual fentanyl spray for breakthrough cancer pain. So this is an opioid, and we all are probably pretty familiar with the level of scrutiny that opioids in general are under. So Insys has a lot of things that go along with an opioid. They have a black box warning, they have a REMS program in place, and like all other companies, pharmaceutical companies, they are required to report under the Sunshine Act, and there's a significant amount of spend on physicians that has been reported to CMS during the first 3 reporting periods. Next slide, please. Now, I'm going to quick take a look at some of this spend, and so these are actual screenshots from the CMS Open Payments website summarizing the payments that Insys has made pursuant to the Sunshine Act. And you'll see over the course of the first 3 reporting periods, $2.7 million in 2013, up to $7.5 in 2014, and 6.2, almost 6.3 last year. So a total of about $16.5 million over the 3 reporting periods. And we're focusing our case study on Insys today because we've already seen multiple instances where correlations are being drawn between this spend that is being reported on the CMS Open Payments website, correlations between that spend and prescription data for Insys' drug Subsys. And you're probably familiar. You can get onto the Open Payments website and you can drill into the data that is there and find out what particular physicians are being paid in various categories of spend. And with the data mining that's going on, that's exactly what's being done. Next slide, please. So let's jump right in and start looking at some of these instances where correlations are being made between Insys spend data and Subsys prescription data. What you have on screen now is a complaint that was filed in August of this year, just a couple months ago, against Insys by the Illinois Attorney General. And you can see from the language that I've highlighted that the Illinois AG is alleging here that excuse me, that Insys has marketed Subsys to high-volume prescribers. It goes on to say, the headline goes on to say, without regard to whether prescribers treated cancer pain. So there's an element of off-label promotion going on here, but we want to focus today on the payment aspect of it. Next slide, please. This particular section goes on to talk about and point out that an incredibly high percentage of Subsys sales within the state of Illinois from April of 2012 through March of 2015 were generated by only 10 prescribers. And the highest prescriber, you can see it highlighted here, Dr. Paul Madison, wrote 58% of the prescriptions, of the Subsys prescriptions in Illinois. So very high prescriber of Subsys, and the complaint here is highlighting the fact that he is far and away the highest prescriber within the state. Next slide, please. The complaint also alleges that Insys used, in making payments to physicians, including payments to Dr. Madison, used sham speaker programs as a mechanism to pay these high-volume prescribers to actually prescribe Subsys. So the complaint is saying that these speaker programs didn't really have any substance to them. They were specifically called out as sham programs that were a way for the company to be able to pay prescribers to prescribe Subsys. And further downward in the language that I've highlighted, the speakers are alleged to have not discussed much at all about the product. Again, really the focus of these programs was as a mechanism to pay the speakers to prescribe. The complaint then goes on to allege, next slide please, Mohammed, goes on to allege in particular that Dr. Madison received over $84,000 from Subsys in speaker honoraria between the end of 2012 and the middle of 2015. During that time, the complaint alleges that he spoke about 46 times. So you can see that there is a direct correlation that's being drawn here between the amount of money that Dr. Madison has been paid by Insys in connection with these speaker programs and his prescribing activity. Dr. Madison, just kind of as an aside, was indicted in December of 2012 on federal charges of healthcare fraud. That's a case that's still pending, and I'm not going to go into any more detail on that, but that's just kind of an additional piece of information. So this is more from the complaint, and you can see it's kind of cuts to the chase as far as what violations the Illinois Attorney General is alleging here. And they allege that the company, through these activities of paying these speakers to allegedly prescribe the drug through their speaker programs, the complaint is alleging that the company violated the Illinois Consumer Fraud Act by engaging these physicians, or the company was engaging in deceptive and unfair acts by paying prescribers to prescribe substances under a sham speaker program. See that in the language that's I've highlighted in section C there. So again, the Illinois Attorney General is making a very clear correlation between the payments made by Insys to Dr. Madison in particular for the speaker programs that he participated in. So a connection between those payments and the subscriptions that were generated by Dr. Madison. One of the things that the Illinois AG is seeking to accomplish here, and one of the remedies that they have asked the court for, is to have Insys permanently enjoined from engaging in trade or commerce in the state of Illinois. So they want to basically shut the company down from doing business in Illinois. Next slide, please, Mom. So the Illinois case, as mentioned, it was just filed in August of this year, so it's obviously an active case, so we don't know how it ultimately will be resolved. But last year, in August, Insys signed an assurance of voluntary compliance with the Oregon Attorney General in a case that also involved allegations that Insys provided improper financial incentives to physicians, again, to induce them to write prescriptions for substances. As you can see on this slide, this is a press release regarding that case. Insys settled this case for $1.1 million last August. Next slide, please. This next slide is the notice of unlawful trade practices from July of last year, and this is a document that was filed by the Illinois Attorney, or the Oregon Attorney General, and it sets out the AG's allegations against Insys. And here again, we can see, in its highlighted language, the Oregon AG is specifically connecting the dots between payments made to Insys speakers and the prescriptions that the speakers have written for substances. That top line that I've highlighted, through its payments to Gallant and Rosenblum, and those are two physicians in Oregon, Insys unconscionably sought to increase prescriptions written for a substance. Gallant was chosen as a speaker not because he was qualified to speak to doctors about substance, he was not, but to incentivize him to prescribe. So you can see that, and it goes on talking about the amount of prescriptions that Gallant and Rosenblum had written within the state. A large percentage of the prescriptions that were paid for in the state of Oregon, and the AG is mining all this data, the prescription data as well as the payment data, to be able to draw this correlation between the two data sets to support its allegation of improper financial incentives to Drs. Gallant and Rosenblum. So that's two state enforcement actions against Insys, and the company has also disclosed in its public documents that there are other state investigations going on. We don't yet have a public federal enforcement action against Insys, but the company, Insys, has also disclosed that the feds are investigating, so we know from the company's own statements that is happening, but we do have these two active, or one active and one settled state enforcement actions against the company. Next slide, please. So we're also seeing these correlations between Insys spend data and substance prescriptions being drawn in private litigation. What you see on screen now is a shareholder complaint that was filed against Insys in Arizona in October of 2014. And you can see the highlighted language. There's an exhibit that's attached to this complaint that is a spreadsheet containing a list of payments from Insys to physicians from the initial reporting period under the Sunshine Act from August 2013 through December 2013. And so they are directly referring to this data as part of this shareholder complaint. So this complaint was filed on behalf of purchasers of Insys stock, and it alleges that the company has misrepresented or omitted information about the sales and marketing of Subsys. And among the sales and marketing tactics that are being complained about are the payments that the company is making to these physicians. And so Exhibit D it's a 39-page spreadsheet, and it details the 5 months worth of data from 2013, that first reporting period under the Sunshine Act, and really it sets out speaker payments to 170 doctors that were. Next slide, please. So as we get to the next slide, you'll see that the language of the complaint, again, it draws a correlation between the Insys payments and the Subsys prescriptions. You'll see in the highlighted language here that they're alleging that Insys appears to have paid over $2 million to these physicians in that first reporting period under the Sunshine Act. Some of the doctors were paid tens of thousands of dollars. And the company has made statements that a fairly small subset of doctors are responsible for a large percentage of prescriptions of Subsys. In that last line, you can see defendants being Insys, appeared to have targeted these doctors and rewarded them generously for writing Subsys prescriptions. Again, they're essentially alleging here that the payments that Insys was making to these physicians, these speaker physicians, were kickbacks to induce these physicians to write prescriptions for Subsys, an activity which would be illegal under the anti-kickback statute. Next slide, please. This next slide is actually a summary sheet as part of this Arizona complaint that summarizes some of the data in Exhibit D. So again, summarizing data coming directly out of the first reporting period under the Sunshine Act. The first highlighted line summarizes payments to all of the physicians for that first reporting period. The second highlighted line there highlights the payments to the top 10 physicians, and then the third highlighted line is the remainder, the payments to all but the top 10. And so you can see that, and then at the bottom there's the specific reference to the open payments data on the website, the CMS website. So it's very clear that the plaintiffs are mining this data and using this open payments data to make their case that the payments that Insys was making to physicians were amounting to kickbacks. And they also they identify particular outliers who are responsible for a large number of those prescriptions. So Insys settled this case in Arizona, this shareholder case in Arizona, last year for $6.1 million, and they settled it pretty quickly. The suit was originally filed in October of 2014, and the company filed a stipulation of settlement with the court in May of 2015, and that settlement was finalized in December of last year. So again, you can see that the central feature of this case that was settled by Insys was the spend reporting data that was reported to CMS. Next slide, please, Mohammed. We've had another shareholder case, shareholder lawsuit filed against Insys, and you can see that here. This suit was filed in August of 2016, so again, just a couple of months back. And this suit also alleges a correlation. In fact, you can see that in the first highlighted language here, that the plaintiffs here are alleging that a review of Medicare prescribing data and payment data submitted under the Sunshine Act shows a strong correlation between prescribing habits and receipt of speaker fees. It goes on to talk about the top 10 prescribers of subsys in the Medicare program in 2013, and 8 of those top 10 were also paid for speaker programs in 2013 and 2014. Then the second set of highlighted points out that those 8 speakers received between $67,000 and $154,000 in total payments in those 2 reporting periods. And they're making very clear that these plaintiffs and their counsel are mining the open payments database as well as prescription data in Medicare to establish this correlation between payments received and prescribing. Next slide, please, Mohammed. So there's a specific reference to the top 10 prescribers in that second shareholder complaint, and this is a graphic that shows the top 8 prescribers, and we're going to take a look at some of these prescribers in a little bit of detail. So these are the top 8 subsys prescribers in the Medicare program in 2013, and they're ranked according to the number of prescriptions that they wrote. And you'll also see in this graphic the amount of money that Insys spent on each of these physicians for August 2013 through December 2014, so the first 2 reporting periods under the Sunshine Act. And you can see that a lot of money being spent by Insys on these individuals who are writing a lot of Medicare prescription. So let's take a little closer look at some of these physicians. This next slide is an article from the New York Times from 2014, and they ran this story, detailing information on Insys payments to physicians. And the Times article really focused on physicians who received significant payments from the company and who also were found to be in some hot water of their own. And according to the New York Times, 5 of the top 20 prescribers of payments or 5 of the top 20 recipients of payments from Insys have faced some sort of legal or disciplinary action. And the article also notes that many of these physicians were also top prescribers of subsys. One of the top prescribers mentioned here on the top left is Dr. Somerville. And we just saw in the graphic we looked at a couple slides ago that Dr. Somerville was the number 7 Medicare Part D prescriber in 2013, and he received $67,000 from Insys in 2013. And remember, that reporting period was only 5 months from August through the end of the year, so $67,000 over the course of 5 months paid by Insys to Dr. Somerville. In addition to the, that piece of information around his spend and his prescribing, he was also, as this article points out, he was investigated by his state medical board and actually ordered to stop prescribing prescription painkillers. So he's getting into some hot water, outside of the prescription activity with respect to subsys. Further down on the right hand or the left hand column, you can see that the article also mentions Dr. Auerbach. Dr. Auerbach was the top Medicare prescriber of subsys in 2013. He received $56,000 from Insys in 2013, and that ranks him number 3 in spend for the company during that first reporting period. And as you can see from the highlighted language here, Dr. Auerbach was actually arrested in 2014 on charges of healthcare fraud. The next slide, please, Mohammed. The next slide presents the complaint, the criminal complaint that was filed against Dr. Auerbach in May of 2014. And as we previously saw, and highlighted language here points out, he is far and away the biggest writer of subsys in Medicare. You can see he wrote during the time period set out, he wrote more than 6 times the number of subsys prescription as his next closest prescriber. And when you drill down further into the open payments database, you can start to see the correlation between his prescriptions. Next slide, please. You can see this correlation between his prescriptions and the amount of money that he received from Insys. Looking at the summary of payments received by Dr. Auerbach, and these are again screenshots from the Open Payments database. You can see, this data gives us a perspective on how much Insys was paying Dr. Auerbach relative to other companies. You see in 2013, overall he received over $90,000, $44,000 of which was in compensation from Insys. And similarly, in 2014, he received almost $65,000 from all sources, almost $31,000 of which came from Insys for speaking and consulting. After Dr. Auerbach's arrest in 2014, these payments from Insys dried up, and so that probably explains why 2014 wasn't higher than it was. But you can see that there is a significant portion of his payments, overall payments, coming from Insys. So that gives you some of that perspective. So, Mohammed, can you give us some more insight on Drs. Auerbach and Somerville?
Sure. Thank you, Brian. So let's take a quick look at the data from both Medicare Part D and open payments. In this first instance, we're looking at top prescribers for sepsis. This is data coming in from Med Part D. And what you can see on the screen is Dr. Auerbach. He's the top prescriber. But the thing that's more interesting is that he's almost 3 times the next highest prescribing physician in terms of the dollar amount of prescription written. He's also almost equivalent to the next 3 highest prescribing physicians, right? So he's definitely an anomaly in terms of at least prescription writing patterns. Further, we want to look at maybe the spending patterns for Dr. Auerbach. And Brian had shown the screenshot from Open Payments website, but maybe if we look at it a bit more graphically, I think the story is more obvious. If we look at the left half of the slide, spend by year, we see that Dr. Auerbach does work with multiple pharma companies, but the Insys Therapeutics payments, which are in orange color, stand out. And as Brian has shown in the earlier slides, if we total payments from all the other manufacturers combined, they still are lower than just Insys, right? So Insys paid them individually more than the rest of the pharma companies combined that were working with Dr. Auerbach. Similarly, on the right-hand side, when we start to look a little bit deeper into the type of spending, what we notice is a huge percentage of the spend is in the bucket called speaker programs, right? So almost 70% of the spending that Insys did with Dr. Auerbach is around speaker engagements, and that was part of the losses that we saw earlier. And we'll see this as a consistent pattern as we go through more data sets. Looking and drilling in a little bit further into Dr. Auerbach's profile, it does seem like he works with many pharma companies. And just to give you a sense for what this dashboard represents, we've selected Dr. Auerbach, and it's telling us that Insys worked with him for 36 speaker programs, which is right here in the middle, and he did engage with other pharma companies, Forest, Purdue, and Sanofi for several programs, but clearly Insys was the highest payer as well as engaged Dr. Auerbach the most. On the right you see payment patterns, and we can see Insys made almost 23 payments of amount close to $2,500. So that must be an individual speaker fee payment. But this data in itself does not indicate any legal or unethical behavior, right? And the question really remains, how do we identify high-risk physicians? What are some of the common elements to look for before one invests time and energy in deeper investigation? So this is a question we want to try to at least look towards answering. How do you easily highlight, identify, and pinpoint high-risk physicians as a compliance team and really go towards getting more details onto those physicians rather than looking at every physician that you work with? And one of the ways you can do this easily is to look at a spend versus prescription scatter plot of all your physicians. This is a very simple and visual way to look at your entire physician population. But don't confuse this or take this simplicity, take you away from the amazing power that this chart has to highlight compliance risks and really focus you on the top high-risk physicians that you should be looking for. So on the x-axis at the bottom, what we have is spend, and on the y-axis, the vertical axis, we have prescriptions. And of course, the spend data is coming from open payments, and prescriptions are from Medicare Part D. This is for an actual pharma company, and what I'm just showing you real data so that you get a sense for what this would look like when you do this for your own company. What we like to say on the left part of the plot is lower risk physicians. These are physicians that are writing a high amount of prescriptions, but you're not really engaging them from a spend perspective too much, right? So you're doing very little activities with them. However, they do write a lot of prescriptions for you. So maybe not as high risk from at least a kickback perspective. And similarly, on the bottom portion of the graph are physicians that you work a lot with, right? So they are maybe your KOLs, you're engaging them in research and other activities, but they don't actively write a lot of your prescriptions, right? So they're smaller in terms of prescription writing. However, the spend that you have on them is extremely high, right? So besides these regions of low risk, you have this whole area on the chart that you could consider as more of a high risk area, and really look towards physician in these areas. And maybe I forgot to mention, but each dot on the scatter plot represents a single HCP or physician that you work with. And I'm going to show you a couple more of these scatter plots taken from actual data for real pharma companies, just to give you a sense for how they might look like. So here's another example. This company again has a very low risk profile because it seems like most physicians are falling in the lower risk ranges. Let's take a look at another one. Here we have some interesting cases because there's a lot of dots that are in this area that we call high risk, where there is high level of prescribing activity and the spend numbers are high, right? So these are, again, this image or chart in itself does not indicate any level of illegal or unethical activity. This is merely a starting point to focus compliance efforts onto at least the highest or higher risk physicians, because when someone is looking at it from outside the company, what they will see is at least start from the high risk, high correlation, where there is higher spend for higher prescription behavior. So at least that's where they would start. So it makes sense for us to, as we're looking at it internally from a company perspective, to also start from that perspective. So I showed you a few of those scatter plots just to give you a sense when you do your own, but now let's take a look at Insys Therapeutics. So again, the same scatter plot and the same lower risk areas, and you see a huge portion of Insys physician showing up in this right-hand quadrant, which is what we call high risk. Also, what I've highlighted here are red dots, and these are the dots for physicians that we will talk about today in this webinar. So these are physicians that have either been alleged in any of those lawsuits or have already been prosecuted together with Insys for kickbacks. Right? So you see all the dots red dots are in one specific area of the graph, and we're only looking at 5 dots right now, whereas there are many others, right? So it only begs the question whether there will be additional lawsuits as states get engaged and start to look at this data more closely. So one of the other physicians that Brian had talked about, Dr. Somerville, when we take a look at him, he's the red dot right here. We have around 70K or 67K in terms of spend, and almost prescriptions written are around 1.3 million. So when we go a little bit deeper into Dr. Somerville's speaker programs, we see that Insys is the only company that engages him, and he's done close to 17 speaker programs for Insys, and the average payment seems to be around $2,400 across the 3 years. So again, this is just an additional detail, doesn't in itself indicate any behavior that might be required to investigate other than what we looked at in the scatter plot. But here's when it gets a little bit more interesting, and when we start to plot Dr. Somerville's spending and prescriptions pattern, we see three areas of high risk, right? So one part of this is when we look at the spend by Insys on Dr. Somerville, we see that Insys constitutes almost 98% of the total spend on Dr. Somerville. Similarly, the second area of high risk is that most of the payments are actually going into speaker programs. If you look at the long bar at the top, that's for speaker program, and it goes above almost 55K for 2013, and the rest of the bars are much smaller, so majority of the payments are for speaker fees. And similarly, the third part that is high risk for these high risk physicians that is consistent is when you look at their prescribing behavior, you see that they're prescribing a high portion of their prescriptions are written for the company that's also their higher payer, right? So again, these are just reflection of these companies being in that top right-hand quadrant on that scatter plot. But when we look a little bit more detail, we see these patterns that should be alarming as a compliance officer is taking a look at it. Especially in this case, if you look at it on the prescription side, the amount of prescriptions written for sepsis are for $1.3 million, and then the next highest prescribed medication is only $70,000, right? So less than 5% of the value of sepsis. So, we just went through a couple of physicians, but as we go through some more, one of the things that we notice is this 3 points of high risk that are common across these physicians for sepsis. And again, this is just in a single case, and across the board, you will have to look at what you consider as your risk criteria. But generally, for Insys, what we're seeing is the prescriptions that are high risk have a high percentage of spend from a single company, namely Insys in this case, right? Generally, that's more than 50%. In the case of Insys, in a lot of cases, it's 60, 70, or even 80%. The second thing we're noticing is that high percentage of spending is on speaker fees and consulting, and we all know that's an area of investigation more often than other parts. And we're seeing close to 70% or higher in terms of the amount of money spent on speaker fees from Insys. And then the third part is, as a result, if somebody were to draw that conclusion, the script writing behavior is showing that more than 50% of scripts are written for that specific company that's also the highest payer or paying more than 50%, right? So these are the three common elements, and as we look through more physicians, I'll highlight these 3 points as we go through for each of those. Now back to Brian for taking us through.
For that analysis, Mohammed. So a few minutes ago, we talked about the New York Times article showing a correlation between money received and prescriptions written. A couple of articles also written by the Southern Investigative Reporting Foundation, or SIRF, also connected the dots between the payments to physicians and the prescriptions written by those physicians. These articles, they detail the payments received by a number of physicians from Insys, and all the payment data, again, that they're analyzing in these articles was mined from the CMS Open Payments database. In this particular article that's on screen now, SIRF discovered that open payments, that the data in Open Payments database showed that Insys spent $204,000 on Dr. Friedman over the 2013-2014 reporting periods, and during those two periods combined, he was the #1 recipient of spend from Insys. And during those two reporting periods, he received the highest amount of general payments because he was #1 of any of the physicians paid by Insys. And this includes, as you can see there, was $147,000 in speaker payments, and Mohammed pointed out involved with the speaker payments because of enforcement activity. So in the call out that's up now, you can see that the SIRF article goes on to examine Medicare prescription data and found that in 2013 that Dr. Friedman was the 15th highest subsys writer in Medicare. So again, SIRF, like the New York Times, like some of these other cases that we've been talking about, is really drawing this correlation between the amounts being spent by Insys on its physician speakers and the number of prescriptions that are being written by these physicians. Next slide, please. So on the next slide, we'll see a table that was actually published in this article as well of the top recipients of Insys spend in the 2013-2014 reporting periods, along with their rank in Medicare prescriptions for subsys. You can see Dr. Friedman at the top here, like we've already alluded to. So he's in 2013-2014. There's that $204,000 in payments that I mentioned, as well as his rank, #15 rank in Medicare prescriptions. So I'm going to turn it back over to Mohammed and have him tell us more about Dr. Friedman.
Right, so once again, we take a look at Dr. Friedman on our scatter plot, and we see him highlighted in one of those high-risk areas. The spend on him from Insys is almost $400K and prescriptions of 1.6 million, right? And he's one of those red highlighted points. When we go closer into the speaker programs, Dr. Friedman was engaged by more than just Insys. Insys had almost 131 transactions across the 3-year period, but there were other companies that he worked with, including Teva and Depomed and Purdue, as we talked about earlier. So, again, focusing on the 3 high-risk areas that we talked about earlier, when we look for Dr. Friedman, we see the same pattern where the spend on him is almost 97% by Insys. The services or speaker fees are the highest category in terms of nature of payments, and then the third part around prescription amount for subsys is, again, very large compared to other prescriptions that he's writing. Almost 61% of all his prescriptions are for subsys. So this is a pattern that we see common, but Brian, you want to talk about the other two? Brian, we cannot hear you.
The last couple of doctors that we want to talk about are at the top of this chart, and this is more data from the SIRF article that I was mentioning a few minutes ago. This article, or this chart, shows Dr. Ruan and Dr. Couch as the #1 and #2 writers of subsys prescriptions in the TRICARE program. So a little bit different data than Medicare Part D data, but drawing on yet another database of prescription data. And we earlier saw in the graphic that there were also the number 2 and number 3 writers of substance prescriptions paid for by Medicare. So these are 2 very high writers. Both of these doctors were arrested and charged with criminal health care fraud. So again, remember the New York Times article we talked about a few minutes ago, kind of getting into doctors who are getting lots of payments from Insys and also getting into some hot water. These are a couple more examples of that. And then, again, Mohammed's going to go into some more details around the spend that Drs. Ruan and Dr. Couch received.
Sure. So when we look at Dr. Couch and Dr. Ruan Zhulu, we see them again in that high-risk bucket for Insys. And in the interest of time, I'm going to go through these very quickly, but the idea here is when we dig a little deeper, we see the same pattern, the same 3 high-risk flags that are common across physicians for Insys. When we looked at Dr. Couch, he's only engaged by Insys, very high number of speaker programs, but he doesn't seem to work with anyone else in terms of speaker. And when we look at his details around spend, prescription, and then the nature of payments, we see those same three areas. Very high percentage of spend coming from Insys, high percentage of spend in terms of nature of payments is around speaker fees, and then of course his prescription writing is almost 50% for Insys as a result. And same thing for Dr. Zhulu. We see him as engaged by Insys, but he also does work with some additional pharma companies for speaker programs for Eisen and Depomed. And the idea here is again to be able to quickly see in a visualization like this the type of activities that this doctor is doing, both with the company that is in question or yourself if you're looking at it, but also the other companies that might work with that same physician. And similarly, the same three risk areas for Dr. Zhulu as well. Almost 70% of his spend comes from Insys. Very high portion of that is in speaker fees. And then on the prescription side, he's writing almost 36% of his prescription for substance. Again, in this case, the prescription amount is slightly lower in terms of percentage points. But the pattern is very similar across these physicians that we looked at. And just in terms of coming back to what we started this webinar with, Dr. Madison, who's just recently been alleged in the Illinois state of Illinois lawsuit that Brian described earlier. We see the same pattern. Insys is the biggest spender across the 3 years. He does work with some other pharmas, but they don't even show up on the bar chart. Their spend is negligible. And when we look at Insys spend, again, it's concentrated on the speaker program. So same story for Dr. Madison, and we still have to see the results for what happens in the Illinois lawsuit. And when we look at speaker programs for Dr. Madison, again, same story. He's done almost 38 speaker programs for Insys, and the payments range seem to be either $2,200, which is almost 18 payments of $2,200, or around $1,600 for each of those programs. Brian, back to you.
The Insys story isn't done by any means. I alluded earlier to the fact that we don't have a federal enforcement action yet, but the company has announced that it's received subpoenas, 2 subpoenas, one from the OIG requesting documents relating to its commercialization of Subsys, basically its sales and marketing activities. And then in September of 2014, Subsys got a second subpoena from the U.S. Attorney in the District of Massachusetts requesting the same sort of information. So we know that there's federal investigation going on from Insys's own disclosures. We know from public information that there's state enforcement actions, one that's been concluded, one that's ongoing. So we're kind of waiting now for the other shoe to drop, so to speak, with respect to these federal investigations that are ongoing. Next slide. I also, as we start to wrap up here, I wanted to point out that the OIG has been talking for at least a year about open payments data and kickback risk. You'll see on the screen now, these are slides from the Pharmaceutical Compliance Forum Compliance Congress that took place last year in October. And Mary Reardon, who is Senior Counsel in the Office of Counsel at the OIG, made specific mention that there's kickback concerns that continue to be looked at by the OIG, and she encouraged companies to think about their own open payments as they are kind of trying to determine what sort of risk they may have from a kickback perspective. Mary Reardon kind of reiterated this same point in the 2016 Compliance Congress that took place just a few weeks back. Next slide, please. And we're also seeing in the 2017 OIG work plan, the OIG has described a project, which I'm highlighting some information on right now, but it described a project where it would be analyzing open payments data from 2015 to determine how much Medicare paid for drugs ordered by physicians who received payments from the manufacturers of those drugs. So again, the OIG is going to analyze this data, mine this data basically to see if there's any correlation between what's been paid by companies and the prescriptions that are resulting by physicians who are receiving those payments. If I had to predict, my prediction would be that whatever analysis comes out of this project would be an enforcement roadmap for the OIG and potentially other enforcement. Next slide, please, Mohammed. So I want to kind of close here with one recommendation. You need to know your data. As we've been discussing, data analytics are central to managing a company's risk. The transparency of spend data through the CMS Open Payments database, increases the risk that data can be used against a company. And with 3 years of spend data available now, 3 reporting periods, there's expanded mining of this data going on, and it's inevitable that I think that it's going to be more and more mining of this data. So when you're one of the things to know about your data is where you have outliers. And from what we've talked about, you can see that there's at least a perception that there's a correlation between high spend and high prescriptions. And so there's going to be enforcers who are looking at the type of data that Mohammed has been talking about on his graphs and try to identify those outliers and determine whether or not there is that correlation and whether or not that spend amounted to kickbacks to those physicians to prescribe. And speaker programs in particular, Mohammed alluded to this as well, speaker program payments are an enforcement priority and they're going to be examined closely. And finally, the open payments data that we talked about in the Medicare Part D data, they're a good place to start, but they're reactive. And Mohammed's going to get into this a little bit more, I think, to close out. But that's data that's taken place in the past. So what we need to do is explore ways to do more real-time analytics of the data, and think potentially about other data sets and data dashboards that will allow us to look at this information more real time so that we can take action more proactively than reactively. So Mohammed, any final thoughts on your end?
Yes, thank you. Thank you, Brian. And that's a good point, right? Because when we look at Medicare Part D, it almost comes out a year and 9 months after the ending of the year in which the prescriptions were written or paid for. And similarly for open payments data, the lag between when the spend happens and the time that the data is published is at least 6 months, right? And minimum 6 months and maximum almost a year and a half. So in scenarios like this is essentially a good place to start if you haven't started to do this yet, but it's still reactive, right? You want to make sure maybe starting to look at real time into your prescription data feeds that you might be buying from several providers. And of course, you have your access to your spend data thanks to the transparency movement. Whether you're collecting it on a quarterly basis or for 6 months, you should be looking at spend in conjunction with the prescription data. So just a couple of options to get started if you're thinking about how to go about this. And by the way, we're running very close to the time, so if you do have questions, feel free to ask in the questions section or the chat section, and we'll see if we can answer this while we're on this webinar. Otherwise, we'll be happy to respond to those with email. So a couple of options that come to mind are, of course, if you want to look at this data, you can do an internal build, which is on the left-hand side, and both of these data sets are readily available, downloadable. You can engage your internal IT. 3 things and 3 points of consideration if you take this path. One is to be aware of the data volumes. With 3 years of open payments, we now have close to 40 million transactions, and a similar number for Med Part D. So you'll need someone that can work with around 100 million rows of data. And of course, each year that amount is going to grow. The second part is making sure that somebody that can understand the mapping and merging of physicians across these data sets. There are NPI numbers, but which is a good start, but not available for the entire data set. So you need someone that understands MDM and matching capability. And because these public data sets aren't really great with quality, you may have to do some cleansing and supplement for physician specialty, etc., to be able to get a good use out of it. And in our experience, that's usually a 3 to 6 months project if you can find budget and IT resources to help you with this. Option 2, of course, is to purchase a pre-built capability from a provider that has the 2 data sets merged and hosted. In this option, you can get started in essentially less than a week or 2, and you can take action before the current year ends, and certainly before the next spend reporting cycle, right? Because you want to be in a position where you've looked at this data, and before you go out to spend your report, submit your report for next year. If you can take some actions, at least that will give you some credibility if there was some behavior that was high risk. If you go with this route, again, 3 recommendations to consider. Whoever you select as your provider, make sure the provider will update those annual data sets, both Medicare and open payments release data sets on an annual basis. And then secondly, make sure your provider has a set of pre-built dashboards that will allow you to look at risks and specifically the correlation and scatter plot between spend and prescriptions. And then number 3 is make sure the provider allows you to create custom reports and dashboards so you're able to analyze the data in the way that you'd like to, or create specific reports that are valid for the way you do compliance monitoring. So again, of course, qordata provides one of those environments. If you're interested, we'll be happy to talk to you for that. And I have Brian and my contact information displayed here on this final slide. I'm going to see if there is any questions that we can take at this point. Otherwise, we're happy to respond to this. So we have a question around where can you find Medicare Part D data. So Medicare Part D data is available, and that's asked by Amy. That's available for download through the CMS website. If you need the specific link, I'll be happy to follow up and provide that link to you, Amy. We have another question that says, is there any evidence that physicians are being influenced by the payments made by the industry, barring the few known cases that have been publicized? Brian, you want to talk about that one?
There have been some studies that have been done, and I don't have the sites off the top of my head, but there have been some studies that have been done that have shown that physicians are influenced by some of the spend data that they are receiving, including I remember seeing one study, I think this has been a few years back now, that even the small amounts like small meals, or when the industry still provided pens and pads, that some of those even small amount of spends had an influence over physicians. And so there is some of that evidence out there. I haven't seen, in the enforcement actions that have been brought forward so far, the private litigation, I haven't seen any specific references to that. The focus has more been kind of, making the correlation between the spend and the prescription activity, and kind of almost letting, that speak for itself. But like I said, there is some of that data out there. If you were to Google, to try to find some of that studies, I'm sure you'd be able to find it pretty easily.
Great, thank you, Brian, for that response. And in the interest of just being respectful for everyone's time, since we ran a couple of minutes over, I apologize. But thank you so much for attending the webinar today. We do have a couple of additional questions that we'll respond to via email. Thank you, Brian, for that case study. I really enjoyed it, even though I've listened to it a couple of times before. But really good and fantastic. Thank you, everyone. And if you have any thoughts or feedback or questions around this webinar, feel free to contact us on the contact information provided on this slide. Thank you so much. We're going to close this now.
Thank you all.